Welcome to the Lanyap, a little something extra for your health, your family, and your future. Hosted by Caroline Badon, wife, mama, fitness and wellness guru, fashion and iced coffee lover, and the marketing director and podcaster for the Fussell Group. This podcast is your go-to for real conversations, expert insight, and the heart behind the Fussell Group's mission. Because life's not just about getting by, it's about showing up with purpose and serving the community with what matters. Let's get into it. Welcome back to the Lanyap. I'm your host, Caroline Badon, and today I am here with the founder and owner of the Fussell Group, Tyler Fussell,
Hi.
and the director of sales for Ochsner Health Plan, Jeff Meyers.
Hey, Caroline.
How are you?
I'm great.
Good to have you back. It's been a while.
It's great to be in here.
It's been a while.
Too long.
Yeah.
Too long. And that's my fault.
Yeah.
All right. So today we're going to talk about a bunch of different things: leadership, Medicare, clients, annual enrollment period, all the things. You ready?
I'm ready.
All right. So what is the main difference between the Ochsner Health Plan and other carriers out there?
Well, the biggest difference from Ochsner and the other carriers is simply that we are Ochsner, right? So the Ochsner Health Plan is an Ochsner opportunity, right? So we're keeping everything within the Ochsner umbrella. We do have physicians that are not necessarily in just the Ochsner. Let's say if you go see a physician and he's got his white coat on, it doesn't necessarily say Ochsner on his white coat. So we do have some physicians that are in network with us that are not specifically Ochsner physicians. But from that perspective, we are able to help and cater to people's needs because Ochsner Health Plan is within the Ochsner Health Network. And so, it just kind of all embodies the Ochsner values, and we're just really proud of that, proud of what Ochsner has and what Ochsner stands for, what Ochsner's built over the many years that Ochsner's been in the market. So
what's the story behind launching the Ochsner Health Plan and building that trust across Louisiana? Because it's just a plan in Louisiana.
So the Ochsner Health Plan started before I was over there. So I didn't really get all of the whole behind the scenes growing of the Ochsner Health Plan, with the exception of what I've been a part of. But from a launching of it, it was the desire for Ochsner to obviously be able to help its clients and keep them closer to home. So with some of the other health plans, they've got multitude of choices, right? From a physician perspective, from a specialist perspective, from a going out of network, let's call it, but with us, we're able to kind of contain a lot of that, and we're able to help them stay if they've got an oncologist needs or whatever. Ochsner's got a great, oncology department. And for that matter, really, it's growing quite substantially because now there's a partnership with MD Anderson. So that Ochsner has, and then with Ochsner Health Plan, we're able to tap our clients into that. So it's really a very foundational way of doing things, and it's very, very intelligent, in how that growth is happening. So loving to see that.
I'm sorry, let me turn over. It's very much like Kaiser out in Kaiser Permanente out in California. It is owned by a hospital. Right. It's owned by a hospital network.
System, yeah.
Yeah. So I think it gives it gives the client another, like you said, the whole marriage of the health system owning the health plan.
It brings it all together.
It all together. It's very systematic and very...
and homey. You get to feel like you're at home because you're part of the plan.
Yeah.
You're part of the network.
Yes.
Your physicians are all in tight. And so there's a lot of sharing of data, sharing of information.
And you're not going to have as many denials because they're being ordered from the Ochsner doctors so they are knowing what they can and cannot do.
There's a lot of internal insight that can go on in that. I
agree. And excuse me. I also like the idea that it's a homegrown plan.
Yep.
I love homegrown plans.
Of course. And it's been great. It's been a tough road to kind of get moving. But now that we've got it moving, it's really growing.
Yeah. So you kind of pivoted me to my next question. It was, this plan started in 2020. So we're going on the 5th year.
Correct.
Started in a COVID year, which is crazy. Yeah.
Mm-hmm.
So let's talk about, I know you weren't there in 2020. You were here.
Of course.
Yeah.
But let's talk about some of the things that since you've been there, you've seen like the kinks that have been worked out and things like that from like a behind the scenes perspective. Because I will say, being an agent myself, your clients don't always remember that it's not just the plan. Like there are actual humans here
Correct.
working on that plan day to day.
Yep.
So what are some of those things that you guys have worked out?
So part of the challenge that we had initially was just the growing of the personnel to be able to build the plan out, right? So that's continuing to grow, and it's really awesome because we get some great people behind the scenes, some folks that are working on the pharmacy side that are really helping to kind of cull all of our pharmacy needs together, making sure that we're doing the right thing. We're putting the right pharmaceuticals on the right tiers so that way it's really been good for the member, but also for the agent who's trying to sell the product to be able to have a product that's marketable, right?
Right.
So adding those people, and we had one, and he retired, but now that we've got another young lady that's on the plan side, she is phenomenal. I mean, like if we send over a plan, some information request, if we're looking to onboard a new member and that member's got some questions, we can send a direct line to her. And what's cool about being a small plan is I've got a direct connect with her, right?
Right.
So it makes it simple for me or the sales team to reach out to them. Also, when a new member comes on board, we can do a care management plan for that person to transition them from what other plan they were on, whether it's a direct health insurance plan that they had to their employer, or whether it's through one of the other plans that are in the market. If we move them over and we can bring on that person's their medicines and or whatever other care that they were under, and we could bring that to our care management team, our internal care management team, we can directly reach out to them. We can get answers from them immediately. And all of your agents can reach out to me if they have a question or if they have a challenge like that, because we want to work on that continuum of care so that there's no hiccups, right? Because, I mean, Tyler, you've been in this business for a long time. You know, the way that most people fumble in this is they start the plan on January 1st, and then by February, they're finally getting to go see their doctor. They're finally getting to see their medicines are now finally being taken care of. We can get ahead of that if we know what this person's dealing with. So that's really a pretty cool deal, being tight-knit like that.
I think it goes back to being physician-owned, at the end of the day. The Ochsner Health Plan is physician-owned, much like the beloved People's Health was physician-owned for many, many years. And I find that many people stayed loyal to People's Health because of that, because it had that hometown feel. It had that, it was physician-owned, hometown physicians. Everything was Louisiana-based. It was here. And I think that's really what drove the popularity of People's Health for many, many clients, is they were dealing with local. They weren't dealing with people from another state who didn't understand how to say Boudreaux or Arsenault or whatever. Chapatulas or, Washita or
any of those crazy
anything, right? And so it was people in our own backyard that they were dealing with. And so what I am finding with Ochsner is a lot of the People's Health staff, when they were starting to have to make cuts, are now are moving over.
We do have a fair amount.
You have a fair amount of People's Health employees. And I think that's very comforting, for the agent, because we worked so well hand in hand with People's Health staff. And they're now with you. And just, again, I go back to that hometown feel. Louisiana, we're all about relationships.
Of course.
And we're all about sitting at the kitchen table.
That's right.
But we don't want to deal with outsiders. We like dealing with hometown people. We want to know who you are, where you're from, where you went to high school. Where you went to high school, who's your mama and them, and all of that.
That's right.
And it doesn't matter if you're in Plaquemines or if you're in Shreveport. It's the same feel across the state. It's because Louisiana is relationship based.
That's exactly how we do business.
I think that is what is such a great thing about Ochsner, and putting Ochsner out there is you all are wanting to create relationships. I know you all have taken on the model that People's Health had, where it's almost like that hometown hero, and that you all are also now, you have a senior resource team that you all meet with that gives you the ins and outs of the plan of what's working, what's not, what they like to see, what they need to see, all of that, where People's Health had the same thing. And
Yeah, 'cause
so,
we meet quarterly with those folks. So we have
yes,
one in New Orleans and one here on the North Shore. And then as we're growing the other markets, the Baton Rouge and Lafayette, we're looking to do the same thing. So, but I mean, it's a quarterly deal where we're sitting down with them and we're talking to them about their plan needs,
right.
so that way when we do remodel the plan, every year as the plans
Yes.
change, we know specifically what they're looking for, what their needs are. And some of these people have gone through a cancerous situation. Some of these people are dealing with other things, like they just had a fall and maybe they've had a hip replacement. One lady last time I saw, she had a boot on her foot, so she had twisted her ankle playing pickleball. So it's just all of these people are tied into some way, shape, or form the plan, but they're coming in and they're talking about their experiences.
So let me ask you, I'm going to jump the shark here for a little bit, if you don't mind, but that you all are meeting with these people on a quarterly basis. So let's get a little into the weeds with Medicare.
Okay.
So what are you hearing from them about what's happening within Medicare right now, with the changes that are happening, the big, beautiful bill, the possible cuts to Medicaid? Are they concerned?
They're all concerned because any change in the Medicare world is huge for a Medicare member.
Absolutely.
And it may not necessarily be huge financially, but it is huge mentally. And many of them, that's the biggest challenge that they have is the mental side of it, because they get worried about all these changes. I mean, anytime the federal government raises prices on something, or maybe there's some new taxation, or there's some new costs for whatever reason, inflation and whatnot, all of that directly impacts the senior community probably as much or more than just about any other community across the U.S.
Right.
And frankly, it's because many of them get paid a certain amount, and they have to manage that amount. And then if you add another dollar coming out of that amount, well, then that just came off the top of something.
Right.
So that's the biggest concern that we hear, is just how is this going to change my life monetarily?
How have you found the new prescription drug plan has affected any of your members?
We really haven't seen a huge amount of change in that just yet. And because our membership, we didn't really change the
tiering structure.
The tiering structure or the drugs within the tiers and the formulary and what. We didn't change a lot of that this year. Now, I haven't really seen the plan design for this coming year, so I don't know what that's going to look like for the next year.
We can't really talk about it anyway.
No, we can't. But my point is that even still, I don't know what that impact is gonna look like long term, because it's following it. The impact happened last year, and some of the other plans you've already seen some of that impact. But we held true. And so our members really haven't seen a big change in that or a big adjustment per se. But you never know. I mean, I don't know exactly what that's going to look like for this coming year, or if they continue to do things, or if the big, beautiful bill has made a major change in that space that will come for 26, because some of the things with the big, beautiful bill ain't until 28, so there's a long-term change to this.
Well, and some of them the cuts to Medicaid are a 10-year process. Right. They're not all happening today. Right. It's going to be a 10-year process. So things will change.
100%.
One thing we can
and within that 10-year, it may not even make it to the end of the 10 years because you've got a new administration or whatever.
Right.
All of these things could change, and it's very dynamic. This whole business is extraordinarily dynamic.
It
that.
Is.
One plan's great this year, and the next year they fall off the cliff.
Yes.
And it just happens like that. We don't know exactly what it's going to look like. And we don't even try to, at this point, really compare ourselves to our competitors, just because we don't know what their MLR is going to be, or whatever those things are going to be to change their plans.
And it's different for you because, like we said, you are physician-owned. You're
smaller.
You're smaller. You're more, I like to refer to you more of as a boutique. Kind of like we're a boutique agency. You all are more of a boutique plan because you're after a certain niche. You're after a certain market, and you're wanting those that use Ochsner on a day in and day out basis, whether it's an Ochsner affiliate like St. Tammany Parish or it's a true Ochsner hospital or doctor's group. But it's better for you when your members use those doctors because you have better cost control.
Of course.
So you have a better measurement and management over your plan than when you have those that are not affiliated with with a doctor's group or a hospital group, that they're now having, their networks are so vast that their MLR, which stands for medical loss ratio, is much higher.
Yep.
It's not as easy to control.
Correct. And in a lot of cases, I mean, there's partnerships with some of your benefit programs out there, like a GenCare or like a Oak Street or something like that. And the reason why those businesses exist is so as to be able to be a cost measure savings for the health plan, right? We're able to do that within house, right? So we have the physician groups, we have the oncology groups, we have the endocrinology groups, we have the pathology groups, we have all of these groups that are all internal of us, and then they have that sharing of information.
Yeah, the hospitals,
exactly, because it's all within our organization. So to be boutique-ish, we are that because we have this whole rounding of this group of folks, and it just makes it, for us, it makes it very simple for us to manage all of that. Now, again, we are a small plan and we're still growing, so there are some hiccups that come with that, but we can get through them like that because we have the groups that can help us.
I will say, when we have had a member issue, it has been very, very easy for us to get it rectified by going directly to you or to Donnie Lawrence or to Rick Redmond. And it's a breath of fresh air to be able to do that and not have to call a 1-800 number and jump through Pakistan and then back to India.
or wherever, for that matter. You might get somebody that's in the U.S. sometimes. But, oftentimes you're not. And, don't get me wrong. I mean, we do use some of those offshore folks periodically when the call centers need to roll over to somebody else. So there is some level of that comes within our organization because, again, we're a small organization. We can't answer everything. But the cool thing is you reach out to me, you reach out to Kim, and we have the people that we can reach out to, that we can send a direct email to this one and to that one. And if one of them's on vacation or one of them's out for whatever reason, or either one of them can respond at the same time. We're getting the same information, but it's great because we have that communication. And for that matter, even beyond them, we have the whole bigger outside folks that we could deal with, and we often reach out to them directly as well because, I mean, there's just, we have this back office that really runs the plan and does all of the things that CMS requires and all that stuff that's outside of our little internal niche or our niche group. And so we do have the ability to go to them directly and get an answer. And a lot of times I'm on calls with some of the agents, or not the agents, but with those folks, because an agent might submit a plan that doesn't work within whatever the SEP might be, or they're asking a question. Do y'all really have a disaster SEP that exists through the end of the month, right? And so, yes, we have to, so a lot of times I'm on calls or they'll send an email and they'll say, hey, these are the ones that we have questions on. So I can reach directly back out to that agent for the member's benefit to say, hey, what about this? Did we do this right? And then we can get an answer, boom, and it's passed through. So there is a lot of ease to that for an agent or for a member to get somebody enrolled.
So to piggyback off of that, and talking about, having the Medicare conversation, how would you say Ochsner Health Plan is innovating and preparing for the annual enrollment period of 2025, which starts October 15th?
Correct. So some of the innovative things that we're doing right now, we're trying to be ahead of, from a marketing perspective. So from an innovative stance, John's constantly revamping our website. So it's both member friendly as well as agent friendly. If there is an issue that an agent has a question on one of our evidences of coverage for any one of the 6 plans or 7 plans that we have, then they can go on there and they can pull that down and they can go through it and search it. And it's all searchable right there on our website. Any formulary changes, any new physician changes, all of that from a perspective of innovative is all being directed to the website so that way an agent doesn't have to click on this website and then they got to click on this website to go check for a physician. They got to go.
It's frustrating.
100%. Believe me, I've been in that space as well. And it's tough walking an agent through multiple levels of things, whereas from an innovative perspective, we're trying to be ahead of the game. Yes. One-stop shop. And then all of all of the colors, all of the different things that are relevant to Ochsner as a health network are also relevant to Ochsner as a health plan. So they're kind of, there's some synergy within the whole brand. Yes, exactly. So from an innovative perspective, we're trying to stay within the brand, but at the same time be our own little niche within the brand. So it's really cool. John's doing a great job of doing some things with that.
So preparing for AEP, is there anything you can share yet? I know we can't talk about any, plan specific things, but what would you suggest to a client that's on the Ochsner health plan come AEP? What should they do?
Well, I mean, every year clients should review their existing plan to what the new plan is going to look like every year. So if they haven't reached out to their agent, or if the agent hasn't reached out to their clients, they need to be doing that, one or both.
Communication.
Right? Communication is key in this space.
Right.
Because come October 1st, they'll actually know what the new plan looks like, right? So
they can talk about it.
And they can talk about it. Now, the cool thing is, if it's something that the member doesn't need to change, well, then they know it early. But if they need to change, well, then now they've got from 10/15 to December 7th to make that change, right? To make an election, whether it's to stay with Ochsner, to move to somebody else because, of some challenge that they have, or basically to move from somebody else to us, and that's the cool thing about this time of the year is that a member can be informed. And once they're informed, then they can take and run with whatever they need to do.
Well, and I think that too comes with the point that we always try to stress is like sales gets a bad rap. But in this industry and at this level, it's about service, access, helping our members. And that's when you said knowledge and being informed. Like that's what we do. It's not about making sales. It's about sitting down with our clients and making sure they know what their plan looks like. Their physicians are not covered. Same thing as doctors and prescriptions. But just from, you've been a local agent, you've worked with the agency who is a team of local agents, and now you're at the carrier level, just being on a local agent level, why do local agents matter and how do they help extend the mission of the Ochsner Health Plan, especially small town relationship wise? One
of the things that I've been re-saying this multiple times, and I got this from Tyler, is that this is an educational business that pays you extremely well. But you have to educate first.
Right.
And if you do a great job of educating, that's why many of the people that are in your agency are former teachers or people that were in a profession that allotted towards the teaching profession, right? But you have to have a spirit of education, right? You really need to you got to want to help these people to know what they have in front of them.
A spirit of education and actually care.
But that's obviously the biggest challenge is that you have to care. It can't be about caring what's in your pocket.
Right.
It's got to be about caring for that specific member,
right?
To making sure that member gets what they need, not what you need.
Right.
And so there's other in the insurance space. It used to be people would talk about the insurance salesman or like a used car salesman. Well, why was that? Because they were selling you something you didn't need,
right?
Or they sold you what you needed, but then they upsold it. Right, to get deeper into your pocket. In this case, you're not doing any of that. And that's what I really love about the Medicare space is the fact that we're just educating folks on what they have, right? You've used the term Neapolitan ice cream, right? So, which one do you want? You want strawberry? You want vanilla? You want chocolate? Which one you want?
Or you want all three.
Or do you want to go to Baskin Robbins?
Right.
How many flavors do you really need?
Yeah.
Right. And so it's to me, that's what's really awesome about this space.
Well, that's what I like to be very transparent too about the industry because, and I tell my clients this too, just it makes them feel better knowing that as an agent, we get paid the same commission across the board, no matter what plan we put them on. So I'm not going to come to the table and tell you have to be on this plan because this is the best plan for you in my mind, because they all pay me the same. So as long as we're making the decision to put you on the plan that makes the most sense for you, your physicians are covered, your prescriptions are covered, your hospitals are in network, then we're both happy.
That's right.
That's right. And that's what a lot of people don't understand about this industry is it's not really the bad rap that sales gets. It's totally different.
Sure. 100%.
So I love explaining that to my clients because they don't know that. And when you tell them that, they're like, oh, really? Wow.
And then how many of them come to the table and they say, okay, well, how much is this going to cost?
Yeah. How much do I owe you? Nothing.
Nothing. Because we're educating you. And then the plan pays us very well, mind you,
Yes.
for taking care of the member. And that's the key is taking care of the member.
Yep.
Yes.
And then you get paid on a long-term basis
Yes.
for taking care of that same member.
Helping the member get the real care that they deserve.
That's right.
Yes.
You know, and that's what makes me sad about this industry too, is it's our sweet seniors who have worked their whole life and they deserve to be pampered and taken care of.
That's right.
And there are some bad agents out there. You know,
Yes,
there's
bad
always
Actors
bad
and
apples.
everything, yeah.
Bad
And
actors and everything.
There's
Right.
always bad apples, and they give you that bad rap of, oh, you're just trying to sell me something else or put me on something else, and that's not the
that's not the
purpose of what we do,
That's right.
especially here at the Fussell Group.
That's right.
We're the gold standard of insurance.
Yeah.
We hold that title to the highest standard.
And look, y'all have been doing a great job of training agents in that space for a long, long time. And that's why I love our partnership. You know, it's not just our friendship, but also the partnership between OHP and FIGA, because we have that synergy to where we're trying to do the same thing that you guys are trying to do, in that we're trying to help people.
It's like you're in my brain right now, because my next thing for you was going to be like, what makes a great partnership between a small town Ochsner Health Plan and a small town Fussell Group Insurance Advisors, the gold standard of insurance? We both have that same mission and that same care to want to take care of these people.
It's called character.
Exactly.
You know, so the health plan itself has character.
Mm-hmm.
FIGA has character. You know, and the character is we're taking care of members first. Right? It has nothing to do with the bottom line of how much money everybody's going to make. It really is our why.
It's our why.
You know, and that, I mean, I literally just got goosebumps because that is what I do in this arena. Now, it's crazy for me because I'm not out there trying to get a member.
No.
Right.
I'm out there trying to help an agent get a member.
Right.
And so for me, I build the relationship with the agents or the agencies.
Right.
And then from that perspective, you know, I get to help them help members, which in turn helps us to grow, and it helps you guys to grow, or it helps any other agency that I'm working with to grow. And then fundamentally, everybody wins.
The members are being taken care of.
Yeah,
right.
The members are
So as a leader,
front and center. You know, that's my thought process.
Yeah.
Members front and center, and then we're just basically coming in to help on both sides.
Yeah.
So that's cool.
So as a leader, director of sales for Ochsner, you were agency director here for a while. You've been in that leadership position for a long time. What are some values that you live by in being a leader? Like what are some things that are non-negotiable for you?
Member first. Member first, hands down. And then, you know, like I was saying a minute ago, in the role that I'm in now, the member that I'm dealing with is the agent, right? So because, don't get me wrong, I get to go out in the field. I get to go to, let's say, the Jefferson Council on Aging. They do these big quarterly meetings or twice a year meetings and stuff. And I get to go stand at the booth and greet people and say hello and stuff. And I get to see them on a regular basis because we may be in the Council on Agings, and it's all of the Council on Agings coming in there. So they've seen our faces,
Right.
and then they see our face at this big event, right? So that's really cool. And I get to love on these people. And like I was saying earlier, we have this member advisory group that I think there's probably 12 here on the North Shore that are involved in that member advisory group, and maybe 16 or 18 on the South Shore. Every time that we have one of those, they come in and they give us a big hug because we hear them. We listen to them, right? And so I try to do that with the agents as well, because I want to know what the agents are running into in the field. Like, what challenges are you facing on a day-to-day basis? Is that a mountain that you can't climb by yourself? Which then, if that's the case, can I help them? Or
Right.
do I need to direct them back to you guys so that y'all know what issue that they're having, so that then y'all can help them to grow, which is often what we do. You know, we have this communicative, you know, relationship to where if I find a problem in the field, you know, if we've got an agent that's doing some rogue things, then I'm going to immediately call you guys or call one of the other agencies and say, hey, we got an issue.
We
Right.
haven't
You know?
been called. We don't have any agents. Just to let it be known.
Wow, but I mean, you know, you've got rookie agents that
Right,
just
you've got
don't
new
know.
agents,
And
yes.
that's the thing, is it's not somebody's being disparaging in the situation, or they're not trying to challenge one of their members, you know, issues, but they just don't know what they don't know.
Right.
Right.
And it's like, how do we handle that? And if we do come back to you guys and say, hey, you know, we ran into this situation, you know, could use a little bit of extra education, then you guys are going to take that person and then you're going to say, hey, look, you know, this is what we heard, not being disparaging, not being challenging to you, but let us educate you a little bit. So
Yeah,
let's pull the reins back some. Susan Guidros came over to us from People's Health. You know, she was one of those People's Transfers. And, you know, what she does is just go out in the community and work with these agents that need a place to go.
Mm-hmm.
So we need to get out in the community from a marketing perspective,
Right.
innovative, like what you were talking about. It's not really innovative. It's more old school,
Mm-hmm.
be where the members are, right?
Right.
I learned this years ago at another carrier, but eat, play, stay, and pray.
Mm-hmm.
That's where members are, those 4 places. If you just think of that every day, when you're driving around as an agent, where are they at? It's really cool. So.
I was telling my new agents, last week we were having new agent boot camp. And I told them, I said, stay out of the senior centers. Stay out of senior centers. I said, go exactly what you said. Go find people, eat, play, stay, and pray.
That's right.
Go find people in other areas.
Where they are.
Yeah.
But get out of senior centers.
That's right.
First of all, they're overpopulated with agents.
And many of them have gotten to where they won't allow an agent in there.
Correct.
Like an actual licensed agent. You can come in as a physician. You can come in as anything other than an agent, because an agent's coming to sell something.
Yeah.
Everybody else is coming to offer a program.
I think that's great. I don't think agents need to be in there. Personally, I think there's too many other ways. I'm real big on community events. I think agents need to be in community events. You need to be out meeting people where they are.
Where they are.
Yes. And a lot of times.
Because that's their comfort level, Tyler. When they're comfortable where they are, it's easier to talk to them.
Yes.
But if you catch them somewhere where they're, you're going to their house in a lot of cases, unless, they obviously invited you there. But whenever you go into their house, a lot of times they're a little bit clammed up. Why? Because most of the time when somebody comes and sits at their table,
They're waiting to be sold.
They're waiting to be sold something. They come in with a briefcase full of junk that they're going to set on the floor, and if you said no to that, I got something else for you.
Right.
And in this business,
Doesn't work that way.
but that's how they were sold.
Yeah.
Yeah.
Because that's how their parents were sold. And you
Right.
got to realize
Right.
these people are going off of the mindset of what they were trained with.
Right.
And what they were trained with
Right.
was back in the day,
Yes.
everybody came to your house to sell you something.
Yes.
Everybody.
And it's funny because I have a story for that. So I had a client come in last week. She's on disability, so she's under 65, which is cool. I really, not that I wish anyone to be on disability, but I really like working with those under 65 on Medicare because they just think differently. It's a different age group. It's like
demographic,
to
sure.
piggyback off of what you said. Her mom said, "Why are you going to the Fussell group? You can just call Humana off the back of the card. That's what we do. We don't want agents. They just try to sell you different stuff."
Exactly.
And that's what her mom
That's her mom's
thought.
mentality.
Yes.
100%.
And she's like, "No." She's like, "What you don't understand is I go there. It's free of charge. They take my doctors and my medicines. They put them in. They look at my local hospitals, my zip code, my pharmacies, all the things. And then they present to me what I should be on
That's right.
or give me options.
What
and I
works
pick,
the best for them.
yeah.
Correct.
Well, they give me options and I pick from there. And then I leave and didn't pay a penny.
That's right. And
She's
then I
like,
can
"Why
forget
are
about it because
she-
it's done.
Yeah. She said, "Why are you not?"
Yeah.
You know?
Yeah.
Why are you,
You know
calling the 1-800 number?
But that's the problem. And I think since COVID, so let's peel back this onion, right? Since COVID, a lot of things has happened in our industry. And one of them has been the rise of the call center, the rise of the overseas call center or the overseas calls that tie the member in or the
Could be some baiting
senior.
and switching and stuff
Baiting,
like that.
switching, and it's giving the industry a dirty rap. I'm going to say there is a space for telesales, not call center.
Sure.
Telesales, 2 different models. A lot of times you have people who are in rural areas that it's hard for an agent to get to, or they're homebound, or maybe they just don't want someone in their home. Because I'm going to be quite honest with you. If my dad was still alive, I would not want him in a home with somebody by himself.
Sure.
I would want to be there.
Sure.
And it's not that I wouldn't trust the agent.
It's just the world we live in.
It's just
today.
the world we live in today.
Sadly.
That's why once we started opening our office to retail, I mean, we have people foot traffic every day. But where I'm going back to is our industry has changed. And part of the big, beautiful bill is trying to roll back the fraud that is in Medicare.
Sure.
And it's not just on the agent side. It's on the physician side. It's on the hospital side. It's on lab work. It's rampant across the board. But all of this has really geared up since COVID. So I understand people's hesitation, but I also think if you do your due diligence and find agents such as the Fussell Group, we are very we're very picky with who we choose. We cherry pick.
Sure.
Because I only want
From an agent perspective.
from an agent
Not from a
perspective,
member.
not a member at all. Correct. We agent perspective, we
Yeah.
cherry pick because I do recognize that they are going into the homes of seniors. They are dealing with the most vulnerable age group, the age group that is taken advantage of the most.
Yep.
And we want the best of the best.
Sure.
And I do believe there are many, many, many great agents out there that aren't affiliated with us,
Sure.
but there are many, many great agents out there. So, I just wanted to say that. I've seen the changes in the industry, but I think CMS and our government is definitely trying to make a change. I think our industry is trying to make a change. I know that there's a lot of agents going to the government right now, going to Congress and voicing their concerns over what's happening in the industry to make positive change.
Well, there's a lot of Medicare agent model leadership
Yes.
that are doing a lot of things on the CMS level, like being a sounding board and,
Yes.
and things of that nature. And we've went to several conferences
Yeah.
that that these people exist at, and they're coming in and they're talking about some of the things that their voice is being heard through CMS because agents are pushing that up to them, and then they're
Right.
taking that. So there is a lot of shift that's never been involved. That's really cool. It's really commonplace now. So it's neat how that.
I think in order to be a successful Medicare agent, I think you have to be compassionate.
Sure.
You
better be compassionate.
You better be
Yeah.
compassionate. But I think a Medicare agent is a different agent. It's not and it's like you said, I always say a Medicare agent is an educator.
Yep.
We're going in and we're educating you on what you need. We're educating you on what Medicare A, B, C, and D is. And so I'm finding our industry right now is taking that shift a little bit back towards the street agent.
Sure.
And I'm glad to see that because, again, I think there's some great people out there.
And the challenge with the Medicare world specifically is that not everybody is in the educational business.
Correct.
Of Medicare. They're in the the sales and how quick can I turn one over.
Right.
And that's what CMS is trying to usurp. They're
And
trying to
that's
get away from that.
More in the call center. That's not on the street level.
Not always, but yes, there are some.
There are some on the street level.
But also on the AEP level, you only have a certain length of time
Right.
to be able to close all of your clients. And when you've got a big book of business,
Right.
a lot of times the service component of it goes to the wayside because you're trying to get to everybody.
100%.
And all you're trying to do is just handle that little quick, turn and burn. Okay, well, your stuff is still good where it's at. Let's stay where you are. Okay,
Right.
let's move to the next plan, because things have changed. Your medications have changed since last January,
Right.
whenever you first started this plan. So there's a lot of ambiguity when it comes to that.
Right.
But most agents are very good
Yes.
at doing that. There are some agents that are just like,
You're right.
fly by night, and they're just going to willy-nilly this thing. And, so it just depends on the circumstances. But
I agree.
most of the field agents, like you're talking about,
Yes.
are compassionate. They care. And the people love to see them in their house. I mean, Tyler, when you and I were in the field a lot, how many times did we come home with pies and,
Yes.
Food from the fields and then
Yes.
beer, so-
Yes.
so it's like-
Stories.
Oh my God, countless
Yeah.
stories about that.
Yeah.
And but that was always us being compassionate
Right.
and hearing the member.
Right.
And then they love for us to come back. Now, what should maybe be a 45-minute conversation sometimes went to 2 hours
Right.
because that's what they needed.
Yes.
I mean, that's how I feel sitting at the table with y'all.
100%.
I mean, like,
Yeah, where's your question?
yeah, y'all just ramble and ramble and ramble. I mean, are you getting to the senior age here soon or what?
Well, some of us at the table are.
I see a little gray in your beard.
Yes. I'm getting way too close, actually.
Yeah.
I just hope to make it, because otherwise the adverse is not.
I hope you choose me as your agent.
At some point I might, I hope not to be certifying anymore at that point, so.
All right. So what is one leadership? I know you're big in leadership and all of the things. Like, what is one habit in leadership that you swear by?
I mean, there's a multitude of things from a leadership perspective that I can give you to chew on right now. Work ethic to me is probably the biggest thing that, you have a challenge finding work ethic in a lot of folks nowadays, right? They want it now.
Right.
So to me, the biggest leadership goal that I teach new agents is you got to be working every day. So you can't hang the shingle outside of your building, which many of them probably don't even know what the heck a shingle is. Right. So it's a little slate thing that you hang on the outside of your building saying who you are, but
on your phone.
Yeah, exactly. It's not on your phone, but many people don't understand that you got to have that shingle out all the time. When you're a new agent in this business, your work ethic has to stand for something.
You're always open for business.
You always have to be open for business. And if you're always on vacation or if you're not always reachable to your consumer, because I tell you what, this Medicare space, those people a lot of times have challenges. They may also want to just call you and talk to you about something.
Right.
There may not always be time in your schedule for that, but you don't just push them to the side, right?
Right.
Because that's unfortunately the problem that the folks in the 65 plus arena have seen a lot is that they just get cast to the side and their ideas and stuff don't exist anymore and whatnot. So work ethic, Caroline, really is the key to me. I mean, what is somebody reading every day to get themselves better? That's part of that work ethic, right? If you have to be somewhere at 9:00 every day, what are you doing from 6:30, 7:00 to 9:00, right? Are you just sitting on the couch watching Good Morning America, or you actually learning something, right? That's something that you just took on not long ago with the reading. And I say, not that you didn't do it before, but with your business.
I was watching Good Morning America. I was watching the station.
Whatever. But my point is that, your business coach kind of talked to you into doing some of these things. Yeah, 100%.
Changing up my
and why is that? Not because of the work ethic, but because you needed to learn stuff to have a different perspective.
I will say too, being my age and having a 1-year-old, there is no reading a book at 6:30, 7:00 in the morning.
I get it.
Yeah.
But I make sure there is time to do it. Maybe I'm not reading it with my eyes, but I'm listening to it with my ears when I'm driving, or when I'm in the gym, I'm listening to it. Like, you have to have those non-negotiables and want to be a better person and be successful and grow and be an innovator and learn. And you have to have that mindset. So work ethic is key.
Well, and growth minded inside of the work ethic.
Yeah.
Right. Yes. So you just keyed on something else that's really just,
you have to want it.
It's like, wow, people just don't understand that there are technologies out there that help you to do that, right? There's podcasts, there's Audible, there's
Audible is my best friend.
Me too. I love Audible, So one of the books that you recommended, I knew I wasn't going to have time to actually read it, but I downloaded it on Audible as soon as you recommended me. We were actually on the phone, and I stopped and downloaded it. And then I started listening to it. Now you can get nuggets out of those things. And what's cool is it's often the author.
Yep.
That's the one that's doing the reading. Sometimes
the
the author is not very good at doing that, but they'll get somebody else to do it, or they'll get it in somebody else's voice, right? But what's really cool about those types of things is you can do that at any time. Yeah, at any time. Sometimes I'll be sitting in the sauna and I've got a book playing. I don't always walk in with my AirPods, so I'll play it on my phone. But a lot of times I'm sitting in there and I'm going to be in the sauna for 15 minutes because that's all the time that I got. But I could get a lot out of a 15-minute session.
Yeah.
But I also follow a lot of different people, in the space of growth, right? So,
and I think too, for my generation, piggybacking off of that is social media. If you follow the right people on social media, anytime you scroll, you are going to learn something.
That's right.
Yes.
You are going to read something positive. You are going to see a new idea or something of that nature. It's who you surround yourself with, who you follow, and the life you choose to live for yourself, because it's all
there.
All of it.
There's a lot of information out there for some consumption.
Yes.
The challenge is you can very easily fall off the cliff of
Yes.
your work
And
ethic
doom
for the
scroll.
day
Mhm.
and doom scroll or doom listen or whatever.
Yeah.
You can really get way off the rails. So you have to be very diligent about that too.
Yep.
Same thing with emails.
Yep.
I mean, how many times have you gotten to email purgatory? You get up in the morning and you're trying to do some things and you've got a mentality of what you're going to do that day, and you open your email.
Mhm.
And 3 hours have gone by because you're trying to answer all these emails, or one person messes you up by making you mad, and it happens, and then it just derails your entire day.
Yep.
And when they derail your day, you just let somebody else take over your work ethic.
Yep.
You know what I'm learning to do is put emails later in the day.
Sure.
Try to get other stuff done first.
Exactly.
Podcasting.
Well, there's this book out. I read it years ago. It's called Eat That Frog. Right. And so Eat That Frog, that's what they talk about.
Mm-hmm.
So you if you're going to eat a frog, nasty, slimy frog, when do you want to eat it? The beginning of the day. You want to get that big thing out of the way. Just knock that crap out of the way. And then you can go on to the rest of your day. Right. Or the other statement is, how do you eat an elephant? One bite at a time. Well, you ain't trying to eat it all at once. And that's unfortunately what you try to do with emails a lot of times. You sit there and just you consume it all, and it just turns into a mess. So,
So
I'm taking over your conversation.
if it's a messy Monday,
Yes.
what is your go-to song on a messy, not even messy, just busy on a Monday? What'd you listen to on the way here this morning?
I mean, I was listening to an audible this morning. So, but a lot of times, if I'm in my truck, most of the time I'm trying to do things, so I'm on the phone with agents and stuff a lot of times. But whenever I'm at the gym, that's a different ballgame because I can't listen to an audible and get into the rhythm of the gym, right? I just can't.
No.
I might read a book while I'm sitting on the bike doing the thing. But,
cardio.
yeah, exactly. But wow. I've got to have some upbeat stuff, and I think this is where you and I kind of a lot. I love Lil Wayne's albums. And so, I don't have a specific song.
Weezy Baby was just in town.
He was.
He was at the fight,
Oh,
the Dustin Poirier fight.
Yeah, I didn't know that. That was awesome. But yeah, so I always I put on Lil Wayne, and I have his channel pulled up, so I get a lot of his songs, but then also songs that he
get a mix.
Yeah, exactly. That plug in and stuff. So, but it does. It keep. But then I'm so zoned out, that
you're trying to really listen to what they're saying.
Oh yeah.
It just takes you out of the chaos of the real world because you're like, what did he just say?
Yeah, exactly. Yeah, and there's a lot of times where what he just said is very specific. So,
right.
I don't have a specific song within his. I just love
best advice you've ever received, even if it was from Lil Wayne. I mean,
oh man, best advice that I've ever received. Jeez, recently, and I say recently, within the last 10 years, the biggest thing that really stands out is be you.
Mm-hmm.
It just, whatever it is.
Be authentic.
Yeah, be you. Just be who you are.
Mm-hmm.
And every time you're around me, I'm me. Mm-hmm. Now I've got two sides of me. I've got Jeff and I've got Jeff Rowe. But Jeff is the professional guy. Jeff Rowe is the fun, let's go have a good time guy. Mm-hmm. So on the professional side, you always get me. I'm consistent, right? And so that was something that I'd learned, and it kind of resonates from years ago. I mean, I started in this business in 2001, and I had a great couple of leaders, Danny Young being one of them, and Danny was always consistent. So I always followed that lead, but he was very authentic, and it just, you knew he was. It didn't matter if I was having this kind of conversation with him or he's on a stage in front of 10,000 people. It was always the same person. So I tried to emulate that, right? Mm-hmm. And then somebody really said that, and it really resonated. Like, I didn't know I was emulating it because, that's just the number one way that you flatter somebody is by emulating them, right? Mm-hmm. And so, I kind of kept doing that. And then now I see my kids doing the same thing. Mm-hmm. And it's really cool. And I mean, y'all are sitting next to each other, and how proud are you of her from all the things that she's taken on. So just to see, my kids doing some of the same is really cool because they've learned that sort of emulation over time. So being authentic and that has been probably the biggest lesson I've ever learned.
And it ties well back to the position that you're in, because every health plan has a human behind it
That's right.
who cares and is trying to make it authentic and make it more personable and build that relationship with the community. So it all ties well together. You know, it makes sense.
It does.
So, and especially sitting here today with a boutique carrier and a boutique agency, that local community relationship building, all of it is just so important. And it's a pretty little bow on top of the gift, you know?
Right.
So
Love the little bows.
yeah. So, thank you so much for joining us, Jeff. It was great to have you.
What's your favorite ice cream?
Favorite ice cream. Mine is cookies and cream. Bluebell cookies
That's
and cream.
super childish of you.
Oh my God. I just get, Bluebell is
Have you ever had the butter pecan from Hoodoo?
not from Hoodoo. No. Now the butter pecan or it's something different with Bluebell, but there's one that's similar to that I really like. So I may have to try Hoodoo's butter pecan.
Should take a little walk. You're very close.
Well, believe me, I know. I remember taking the kids one day when
To Hoodoo. He loves Hoodoo. Yeah.
I did get to walk down there with the kids during training one day. That was pretty fun.
Jeff, thank you so much for joining us today. It was
I
a
love
pleasure having you back. We missed you.
I'm glad that I surprised y'all this morning and you invited me on
and
this.
I threw you on here, huh? Nothing like last minute.
Hey, but
Thanks
you know
for
me, I
rambling
love
with
it.
me. You know what you did with that. That's
We always do
that's
really
our
good with rambling.
jam. We love to ramble.
Thanks for joining us. If you'd like to follow us on Facebook, Instagram, LinkedIn, or visit our website at fgiala.com or give us a call at our office, 985-875-7407. Thanks for joining us on the Lanyap. We hope today gave you the little something extra that you needed. Be sure to subscribe, share this with a friend, and follow us on social at FGIALA for more tools to live well and make the right decisions for your health and future. Until next time, stay golden, stay the course, and never forget, we'll be there for you.